feel like being a care manager has been one of those things I always felt was needed, but didn't exactly know it even existed. Just knowing from taking care of my grandparents and family members, you know, they go and they see the doctor for a couple of minutes and they leave with all these questions they forgot to ask. They leave with new medications they have no idea about. And, you know, that's what we're here for. We bridge that gap in the healthcare system.
We're much more of a rural area. It's a lot of farmers, it's a lot of family lands. So it's not necessarily just walking down the street to your neighbor and getting help. We don't have any immediate emergency access. So with ThoroughCare and with the opportunity to be care managers and do CCM with the patients as well as RPM, we're able to be that first line of defense for all the different population that we have. Being able to use ThoroughCare to manage the patients, keep up with their care plans, making sure that we're properly working on interventions, as well as evolve their care plan as they continue to be on CCM. ThoroughCare has been great about making sure that every care manager can stay effective and efficient.
For my side, I'm able to integrate and have all of my patients' information in one place. Even though I'm dealing with 3 different EHR systems, you know, all you have to do is click the button, it pulls your face sheet, it pulls labs, it pulls all the needed information that you could use and want. And so that really helps on time efficiency, making sure, you know, the accuracy of what we're putting in there for the patient is up to date.
As you're in these EHRs, you don't have a good way to manage them and patients get lost. And ThoroughCare allows you not to lose those patients and to keep up with them. And that's why I feel like you continue to be successful through enrollment. To be able to manage from the dashboard, seeing those patients and seeing everything live of how many patients are in CCM, how many patients are in PCM, how many of them have done their 16 days. I honestly don't know what we would do without it.
I really do like the care plan for ThoroughCare. It's very simple to use. I love the functionality of it. It's prompting the care manager, what do we need to address for this particular chronic condition? We identify barriers, whether it's language, whether it's transportation. It's always constant in the care plan. Did you address this? Is this still an issue? Is the patient's health being hindered because of those barriers? And it's just a wonderful feeling when we can check those off and say, nope, resolved. Nope, taken care of.
I love putting side by side in ThoroughCare what we did last month and what we're doing this month. Having the care plan on the same page makes you so efficient and it gives you the data. When you're calling a large amount of patients, you need to be able to have recall. And I love that you can see those things. I love the narrative so that you can put what the patients are saying. It keeps you from being a robotic phone call. You know what you talked about last month. You can see it right there on the screen. Those are some of the ways I think that we're able to retain the patients and be able to make that connection with them.
The health education materials that's available through ThoroughCare. It is created in such a way that patients understand. It's something that they can review when they have it at home because we can send it to either mail it to the house, we can text it to them, we can email it to them. And it's something that reminds them also when they're opening the refrigerator, when they're going to the grocery store to make better health choices. Having that available to care managers, it's so important. It gives us also broad topics to talk about, to reiterate.
The calendar is a wonderful function to be able to put those customizable entries in to know why you're calling the patient. What is the focus? Don't call patients empty. Call them with heart and call them with what they need.
If we're talking with a patient and they went to the doctor recently and they changed up one of their medications, we're able to put it in our call scheduler for a week from now to call the patient. You can label it, it's very user-friendly, and it'll trigger you to call them to follow up. All those features allow us to be able to keep the patient interacted and follow up on things that need to be followed up on.
I absolutely love the relationships that I have formed with my patients. It has expanded my profession, it has challenged me, and ThoroughCare has been instrumental in doing that, in showing me the way as a nurse. Did you consider this? No, I didn't. Oh, but ThoroughCare said, or ThoroughCare suggested, or this update brought it up, so let's go that route. So it's something that is active all the time, being brought to our attention as care managers, the things that we can address and how, again, to better our patients' health. Do I feel like I'm better for it? Absolutely.